Okay, thank you, Beth, for allowing me to record this session. I'm currently in final year of university studying interaction design, and for my final year project, I decided to focus on type 1 diabetes and create an app allowing better self management of the condition. And I just wanted to get other perspectives and understand experiences, so that's why I'm talking to physicians associates of people who'll be dealing like diabetics like yourself. So this interview shouldn't take longer than 30 minutes, but we can talk longer if needed. It's very informal, so don't worry too much about what you say. I just want to understand more about how you care for those with diabetes so I can identify what needs to be improved for the future or what is already working brilliantly and has already been solved. So I'm just going to start with a couple of warm-up questions and just to understand the demographics a wee bit more. So what age are you?
So I am 23.
Okay, great. And what is your occupation, just to be clear?
So I'm a physician associate, but I've only recently just graduated from university.
Okay, great. So we're just going to begin talking about some of your background experience on dealing with diabetics. So will you please be able to tell me about previous experiences you've had with dealing with patients who are diabetic?
Yeah, so we have had multiple patients. I've been in A&E where we would mainly see a lot of people coming in with hypoglycemic episodes. So we'd have a lot of them coming in, being confused, kind of having really low blood sugars. And on the wards, a lot more. I've had a lot more experience with people who have been having hyperglycemic episodes, where their blood sugars are abnormally high, and even with lots of insulin being given, sometimes it's really reluctant to come down. So definitely a lot of diabetics who have been admitted with problems with their own diabetes. But I've also had a lot of people who are just in the hospital for surgeries or in for other problems, but they also have diabetes, so we have to manage that quite closely even when they're in the hospital, even if it's well controlled.
Okay, perfect. And when did you feel confident in knowing what to do with these patients?
So I've only recently graduated from university, but I'm still working on knowing a lot what to do with things. But I would say in the acute scenario, I would know what to do for your hypo and hyperglycemic episodes and things like diabetic ketoacidosis, which is quite common and quite severe thing that we would see in the ED setting mainly. So I'm learning how to deal with those more and more, but I would say I still have a lot to learn.
Okay, yeah, perfect. And how important would you say self-management of diabetes is?
It's really crucial actually to know your own diabetes, how to control it. If you don't control your diabetes well, it can lead to a whole rake of problems with vasculature problems, especially in your feet, your kidneys, and your brain. And this can lead to problems further down the line if you keep, especially having hyperglycemic episodes. But hypos are also really important because people have had car crashes, they have done things that they normally wouldn't do in scenarios where their blood sugar goes really low as they get confused. People can pass out and can become unresponsive. So it's a really vital thing to be able to control your diabetes well.
Okay, perfect. And what would you tell those patients that keep having hypoglycemic episodes? Or what would you suggest for them patients to do?
I think one of the main things that we're seeing coming around more is the continuous glucose monitoring. So patients are being put on things like apps and devices. People have probably seen the wee device that sits in people's arms. So that notifies them when they start to go into hypo episodes. And it's really important to be aware of that. It's important to know the symptoms that are coming along. Some people get tingly lips. Some people start to feel a bit faint, get a bit flushed. It's really important to know for your own self what your symptoms are, because hypos can be very life-threatening if they're not diagnosed quickly. So it's just important to know what symptoms there are and to make use of all the devices out there that could help in preventing you going into a hypo episode.
Yeah, and what would you tell someone who has just been diagnosed with diabetes then?
So we have a lot of patients, especially younger ones from any age. You could be 6, you could be 18 before you're diagnosed with type 1. So people really panic when they hear that they've got diabetes, and it is a stressful time, but it's something that now, especially with new technology coming in, that is being monitored really well. And it is a lifestyle change, but if you control it well and you keep your sugars in the normal ranges, then you shouldn't be having any problems down the line with any other health conditions if you can monitor it correctly. So it's just about staying calm. It's about going to all the dietitians and all the different things that the hospital would recommend you attend, so that you can figure out how to control it well. And we do lots of teaching on what to do if you go into hypo episodes or hyper episodes. And we do that for family as well, so that they know how to recognise symptoms and how to treat them as well.
Okay, that's great. And as we know, lots of new technology is being released over the years to help manage diabetes. Have you seen a change over the years in technology improving your patient's health?
And I would say definitely a lot of the patients we have coming in with hyper episodes or hypo episodes definitely seem to not be using the technology that's out there. I have a few friends who have got devices, have got apps on their phone, have got continuous glucose monitoring protocols in place, and they definitely control their diabetes a lot better than people who kind of aren't using the technology provided. So I think it's really important to make use of the things out there. People are creating these amazing things that help you live a more normal lifestyle and prevent things from happening. So it's really important to use those, and I definitely would see a decrease in the amount of diabetes patients we see, and people coming in with specific diabetic related problems. So I'm hoping the more we kind of get more technology things in place, the less diabetics we'll see in hospital.
And when you were saying there, like less diabetics being in hospital, do you notice that that is a decrease in workload for the nurses, and it allows you to focus on more serious problems and people just not looking after the blood sugars and having hypoglycemic episodes, for example, and being admitted for a day and having to leave? Do you find it helpful then having them using that technology to reduce the workload that you have to do during the day?
It's definitely easier, so it is. If we have patients who have their protocols in place to use that, it definitely decreases our workload. We have to monitor if we have diabetic in, no matter if they're just diet controlled or if they're insulin controlled, we have to monitor their blood glucose at least 4 times per day. So if they have, the wee scanner on the arm, it saves us, going around and pricking them with a needle every couple of hours. So they're definitely really useful. If we have people specifically in relating to their diabetes, instead of just like elective surgeries or other problems not related, we do generally still have to use the finger prick devices, because at the minute they are more accurate than the apps that we have. So I think definitely I see in the future, the apps being just as accurate as the previous devices that we've used.
Okay, yeah. So is there any apps in particular or pieces of technology apart from maybe that sensor one, or would you include it in this list related to diabetes that you're an advocate for?
The only really one that I would be majorly aware of would be the Freestyle Libre. So we have a lot of patients who are coming in with the sensors on their arms, but I definitely would love it if there was more out there. I think it's really important to keep producing new apps, new ways of monitoring it, and obviously with technology and phones advancing, it's incredible. A couple of years ago, I never would have thought you could scan your blood glucose with your phone. So I think just hopefully moving forward we'll get more out there, but Freestyle Libre currently is the only one that I would know that people would use quite often. But again, we have a lot of patients coming in who refuse to have things like that or just can't be bothered.
Okay, yeah. And would you find any time communication with patients through an app helpful? So, for example, patients able to just fire you a message at any point during the week, at any time during the day. Would you find that helpful? And if not, what problems do you see with it?
I definitely think it could be something that is really useful. I think a couple of problems that could come with it would be, people not actually responding on time. If you're having a hypo episode, that is something that you would need to be asking questions of and getting a reply to very, very quickly. But I think for the likes of diabetic nurses or physician associates who are on the ward or maybe on call, having a device that patients could contact you on would definitely be really useful if we could then, send them a message if they have any queries. It would probably save us a whole lot of people and save GPs especially a lot of patients coming in with questions that they might not even know the answer to. So I think with diabetic specialists, physician associates or diabetic specialist nurses, it would definitely be something that having a anytime communication set would be probably really beneficial for a lot of diabetics.
Yeah, okay. And if you could, what would you create that would make looking after a patient's diabetes easier?
Good one. I think just probably apps that, again, alert you to coming into hypo episodes or alert you're coming into hyperglycemic episodes and how to control that. I think ketone monitoring would be really good to have in apps. As far as I'm aware, that's not a thing yet, but that's really important in a lot of patients who can go into DKA, which is diabetic ketoacidosis, which is a life-threatening emergency. That's a lot more common than we think, probably. So stuff that could alert you to potentially going into that and, alert either yourself or family members on that and how to treat it would be fantastic. And also, just stuff that, alert you when you need to eat or alert you when you need to take your insulin if you're going too high. Maybe insulin regimes where it'll notify you what your blood sugar is and how many units of insulin you need, because that would be probably very confusing for a lot of people, knowing what is actually the correct dose of insulin to give depending on your blood sugar.
Okay, great. Beth, thank you so much. All those answers were great. And thank you so much for taking your time and talking to me. It was really interesting to hear what you had to say. You've definitely given me a lot to think about for this project. So thank you very much.
No worries.